As part of our series, Wound Care Legends, we're joined by Dr. Heather Hetrick today, who is truly a wound care legend. Dr. Hetrick is currently a professor in the physical therapy program at Nova Southeastern University. She received her PhD in physical therapy in 2003 and has dedicated her entire professional career to lymphedema, burn management, and wound care. She is a certified wound specialist, advanced wound care certified, a certified lymphedema therapist, and internationally dual certified in lymphedema and wound care. She has attended over 90 continued education courses, authored over 30 journal articles, published 6 book chapters, and presented over 200 professional programs and conference presentations. Dr. Hetrick is past president of the American Board of Wound Management, and she is a past board member of the Association of the Advancement of Wound Care. She currently sits on the board of the World Alliance of Wound Care and Lymphedema Care, the advisory board for the Why Wound Care campaign, and the editorial board for Today's Wound Clinic. Did I get that right, Heather?
Yes.
Well, thank you for carving out some time and joining us today.
Thank you.
You speak at conferences and seminars all over the country. And a lot of the clinicians and caregivers that are out there feel like they know who you are. And clearly, you've presented and spoken and taught to hundreds, thousands of folks. But a lot of folks haven't heard your story about how you got into wound care and how you landed in your current position.
Yeah.
And when we got to know each other a little bit, I was so inspired by that story. I thought that others would appreciate hearing it as well. And it all started about 25 years ago back in PT school. Is that right?
That's correct. Yes.
Tell us a little bit about that, because I don't think you started PT school with the understanding that you'd get into wound care. So tell us about that a little bit.
Certainly. Well, again, thank you for inviting me to do this with you today. And yeah, my story is probably pretty typical as most physical therapists, kind of starting PT school thinking I want to do orthopedics or sports medicine, but I really wanted to work for a professional football team. That was my goal. I love football. And so that was kind of my head where I was thinking I wanted to go. And I think it was the end of the second year or beginning of the second year PT school when we had a guest lecturer come and speak to us, Tracy Mullen, and gave a 3-hour lecture on burns. And I was enthralled. I was so completely taken by this area that I knew a little bit about. I mean, we hear about burns, of course, but I had no idea the level of involvement that a physical therapist could be in with burn care. And so I started a conversation with her and mentioned I have an opportunity to do an acute care rotation up at Harborview Medical Center in Washington, which is probably one of the leading regional burn centers in the country. And, I said, it's 6 weeks. What do you think? And she's like, take it. And I thought, okay, I'm going to like it or I'm not. That's pretty much what happens with burns. You either like it or you don't. And that's understandable. And it was probably one of the best 6 weeks of my life. I remember vividly, and this was probably going 27 years ago, vividly some of the experiences I had up there and the impact the patients had and the doctors and the nurses and the PTs, everybody got to work with. And it was an incredible experience. And from that, I came back to where I went to PT school in Orange County, California, and never looked back. I knew that was what I wanted to do. And if you want to call it a calling, you can. There was something about it that just excited me. I was so passionate about it. I was fascinated about it. And I think part of it is because I'm very visual. And burns, as most people know, and wound care and lymphedema is a very visual field. And for me to be able to see what I do or what the team does visually can make an impact because you can see the progression and you can see the result was just a reward in and of itself. And that's basically how I got started. So Tracy, who's my mentor forever and just admire her, probably one of the top people of my career. They actually hired me before I even finished my master's. Back then it was a master's program. And I started to work at Torrance Memorial Burn Center, and that started my career. And I got cross-trained in wound care, and the two just go hand in hand. And it's been a fascinating journey now looking back all this time. So,
and tell us about the family that came in that ultimately caused another deviation in your life and your career.
Yeah, and this is just what I like to tell my students about too. It's just be open to opportunities. You never know the experiences that you have, what they could lead for you. And we had a family come in due to a house fire on Christmas Eve, a high profile family in Southern California. And it was the husband, the wife, and the little boy. And long story short, they did very well. They recovered from their injuries, but they were pretty significant. And the gentleman who I treated, because he was the most severely burned, he actually ran back into his home to save his wife and his child. We kind of started a relationship, and he wanted to know, well, what do you do? And how did you learn this? And blah, 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 blah. And he actually was a hospital administrator in Southern California, owned many small community-based hospitals, and he wanted wound care, like what he was experiencing in his hospitals. So he offered and asked if I would be interested in being the director of wound services and set up these small community-based wound care programs in these community hospitals. Big opportunity for a 28-year-old female, literally just a couple years out of PT school, but it was such a tremendous opportunity. And that grew into me helping to do some clinical trials and some other opportunities. It was a very challenging job. I mean, I learned a lot. And I think the hardest thing for me was leaving Torrance Memorial Medical Center, because that was my dream job. And this just seemed like such a unique opportunity where I could learn so much about business and administration. And it was challenging, to say the least, to have doctors say, well, who are you? And I'm like, well, I'm kind of your boss. If you don't like me, go talk to so-and-so, But it worked. And I felt really good about the outcomes we had for these patients in these community-based hospitals, and lots of education, lots of training. But it's where I really started to get passionate about education, because that's so huge of what we do with wound care. And then another door opened, an opportunity to teach at New York University, where I'd been going, doing a lot of work for a clinical trial. And I fell in love with New York City, coming from LA, and had an opportunity. They were looking for faculty with integumentary experience, which was like written for me, essentially. And I applied. 3 weeks later, I had the job. And that's how I really got formally started in academia. But it's been an incredible ride, and I'm grateful for every opportunity.
So you started in PT school, and then you got addicted to what it looked like to see and treat burns.
Yeah.
Then you become really an entrepreneur, almost setting up wound care clinics before wound care clinics really existed back then.
Correct.
And then you're in academia, all of just looking for opportunities that clearly presented themselves.
Absolutely.
What happened as a professor at NYU? Tell me about that experience and what that was like.
Well, that was really eye-opening. I had done some guest lecturing at some local PT programs throughout Southern California, just because a specialty area like burns and wound care, their programs are usually looking for people to come give these guest lectures. And I just love the teaching aspect of it. So when I had this opportunity at NYU, I really was able to come in very green in academia, but a lot of support from New York University to just come in and create this whole curriculum for wound management. And ultimately, they sent me to get certified in lymphedema. So that kind of brought that whole thing full circle. And up there, it was a really neat opportunity, because I was able to work up at New York Presbyterian at Weill Cornell Burn Center. I was their director of rehabilitation research, and also at the Diabetic Foot and Ankle Center, which was a limb salvage clinic at a hospital for joint diseases. So I had some tremendous opportunities up there, a lot of great mentors, people I learned from, Dr. Peter Sheehan at the Limb Salvage Clinic, Dr. Yurt and others, Dr. Betsy up at New York Presbyterian at the Burn Center, where I was able to do my PhD, my dissertation work. And I love the teaching. The students were very interested in learning about a field they'd never heard about, and it was New York City. I mean, it was it was just wonderful. It was a great opportunity. So I was there for about 7 years.
And so you've spent most of your life in California, then to New York.
Yep.
And now you're down in Southeast Florida. Tell us about that transition, because you think about the differences between Florida, California, and New York. Those are polar opposites in some regards.
Yeah, I've kind of been all over the map a little bit. So I was up in New York at NYU for about 7 years, and at the time had met my unfortunately, he's now my ex-husband, but my husband at the time, he was a firefighter in New York City. And we went through the whole 9/11 experience together, which was quite an experience, to say the least. But we had twins.
About that, because you were there
Yeah.
in New York for 9/11.
Yes, we were very intimately involved.
As a clinician, as a care provider in the burn space. So that had to be pretty surreal for you.
It was incredibly surreal. You know, ironically, I happened to be down here in Florida the week that 9/11 happened, working on my comps, my comprehensive exams for my dissertation and the PhD program I was in. And I remember clearly that morning, my boyfriend at the time called and said, "Hey, you know, a plane hit the World Trade Center," you know, and he went through the bombing in '93, and there's been other small planes that have hit buildings in New York before. He said, you know, just to let you know, you may not be able to get a hold of me because it's the cell tower and, you know, blah, blah, blah. Well, they pulled me out of class and basically told me what had happened. And the rest of it was really just a blur. It took over a week for me to be able to get back home. I finally made contact with him late on September 11th, knowing he was okay. But his house was the one that was involved in the collapse. So the firefighters that saved Josephine in the stairwell, that was his house. Now, he happened to be at headquarters that day, but what compounded it for us was I lived 5 blocks from the World Trade Center, so I couldn't get back home. And the burn center was on obviously high alert because we were expecting a tremendous number of patients, but we only received 21 that day, and of those, only 18 survived.
Oh, wow.
Some of the worst burns I'd ever seen. But, you know, it was a defining moment just because it wasn't just the day in of itself, it was everything that happened afterwards. So it was a year of just memorials and funerals and dealing with just living in that environment was very, very challenging and quite a game changer for all of us. And just knowing many of the people that had died during that experience was really challenging, very difficult. And for my boyfriend at the time, who became my husband, you know, he was in charge of the FDNY website at the time and monitoring who was known to be gone and who was missing. And it was really challenging, very surreal, as you said. And the burn center, you know, we were pretty busy up there trying to manage these patients who had no idea what had happened, you know, and it took some time for all of us to really figure out the best way to break the news as to what happened and console them and their families and everything. But, you know, those are the types of experiences that really shape your perspective on things and make you grateful for things. And it was a horrible experience to go through, but I'm grateful that it wasn't any worse than what it was, you know, because the timing of when it happened, it's just so many different stories of all of that went down that day. But, you know, as a clinician in burns and in wounds, it tests you. It tests your resolve a little bit. And there was such a connection to these people and the stories. And it's just for us, we couldn't get away from it personally or professionally. So, you know, after a while, I kind of felt maybe it was time for a change. And I ended up joining a DME company, a durable medical equipment company, and left academia for a while and spent about 7 years or so I was being a vice president of education and academic affairs for a DME company where we provided surgical dressings for long-term care. And with that, we felt compelled, you know, it's not just to give you the dressing, you need to know how these work and how they function and the best way to use them. And so I had a wonderful team of people I got to work with. We had a lot of creative freedom to create some really great educational materials, and I enjoyed that a lot. But I was kind of itching to get back to academia. And so long story short, I ended up back at Nova Southeastern University where I got my PhD, and it's kind of been full circle. And I've been here now coming up to my 7th or 8th year, and I love it. I have a good balance of education teaching, but also scholarship. I do a lot of research, presenting, lecturing, writing, service, just the full gamut of everything. And it's been wonderful.
And we talked the other day about the possibility of maybe getting a little bit back into the clinical side at the bedside. Are you able to talk about that a little bit?
Yeah, I really would like to get back into the clinical side. You know, with most academic appointments, you have a certain amount of your time that's geared for teaching and a certain amount towards service and a certain amount towards scholarship. And right now I haven't had enough time with those three pillars to basically focus on the clinical aspect. But I have an idea for a clinic that I would like to do down here in South Florida that would kind of combine wounds and lymphedema, because you can't separate the two as far as skin health and lymphedema. And at best, I would like to at least get in and see patients once a week, if at all possible, just to stay clinically relevant. And there's so much happening in this field at any given moment with not just dressings, but devices and advances in regenerative medicine. And the best way to stay fresh with that is to be immersed in the clinical field. And that's really the part that I'm missing right now. So I need to kind of see how I can rebalance things a little bit, shuffle things a little bit so I can get back in the clinic, because I do miss it. And I miss that rewarding experience of working with patients.
Well, let's talk for a minute. You're in the Department of Physical Therapy.
Yes.
And there are a lot of misconceptions about therapists, in particular physical therapists, as it relates to wound care. And I know you get asked all the time when physical therapy and wound care converge. Statements like, "I didn't know physical therapists were handling wounds and complex wounds," and certainly the professional associations can do their part of creating narratives and messaging. But tell us a little bit about those two things and how they coexist, and what others should know about physical therapists as it relates to burns and wounds and lymphedema.
Yeah, I think what's really interesting is I do get questioned that all the time. It's like, "Oh, you're a physical therapist. Well, my shoulder hurts. Can I ask you a question?" I'm like, actually, you don't want me answering a question about your shoulder. I said, in fact, if you wake up and see me, you're in trouble. Because, you either have a bad burn or a wound or something you don't want to be dealing with. But all joking aside,
most people think about orthopedic, they think about rehab, they think about
exactly.
massage therapy.
Yeah.
What should people really know about what PTs are doing now?
Well, what PTs really, physical therapists really by nature, we're human movement specialists. So we specialize in movement and biomechanics and kinesiology and function and optimizing function for humans, essentially. But with that, it's very much a systems approach, meaning we look at the musculoskeletal system, we look at neuromuscular, cardiopulmonary, integumentary, your skin, and really the interplay with all of these systems and how they can impair or lead to dysfunctions ultimately in movement. So physical therapists have in school, now that we have doctorate of physical therapy programs, they come out as generalists, meaning they have a lot of knowledge about these different system areas and about movement dysfunction and impairment. But typically what we end up doing is specializing after graduation. And there are so many areas for physical therapists to specialize. There are the traditional orthopedics, manual therapy, cardiopulmonary, neurological, spinal cord injury, head injury, pediatrics, geriatrics, and the like. But wound care and lymphedema and burn care and so many other fields are available for physical therapists to specialize in. And then there's a whole array of practice settings where physical therapists can be employed and work. And that's what's wonderful about our profession, because we have a lot of flexibility. You virtually have a job wherever you go. And there's always opportunity for lifelong learning. And that's really key for a physical therapist, is to commit to that lifelong learning. Because, I always tell students, you can't know everything, but you have the ability to know anything. Mm-hmm. And I think it's just very important that we take those opportunities, as tiring as they can get sometimes when people say, "Oh, I thought you just did ortho or Miss." It's like, learning opportunity. No, we do a whole bunch of other things. And,
right.
And it just to let people be aware of our role within the medical system and our role as part of a team member, because we really, I think, can make a big difference for patients and bring our perspective to the table.
And we talked a lot about the cliche of save a limb, save a life, and kind of how that's obviously used and somewhat overused. But we talked earlier about your experience at 9/11 and how that connected to reality. And really, without you and folks like you, there'd be a lot of folks in trouble. Talk a little bit about how wound care specialists, those that are in that field, can connect the dots and really understand, or maybe even folks that aren't in the wound care space but considering it. What does
Yeah.
that look like to you, and what does that mean in real terms as far as connecting what your profession is to actual patient outcomes?
Yeah, I'd like to give credit to Dr. Bell, Desmond Bell, podiatrist in Jacksonville, for that Save a Limb, Save a Life, because he has a phenomenal organization that touts that whole philosophy. But it's really what limb salvage is about. And when I was in New York at the limb salvage clinic at the Diabetic Foot and Ankle Center, we would see patients that were literally told by so many other providers, you need an amputation, or we can't do anything for that. And I feel it's a real disservice, because there are a lot of people that know what to do and can do the right thing for those patients to hopefully prevent that amputation and get them back to a functional level. And I think wound specialists and providers that have advanced training in wound care really can provide such a service to these patients and to the healthcare arena in general by saving dollars. I mean, there's some terrifying statistics looking just at diabetes with, somebody gets an amputation, has a 50% mortality in 5 years, and we need to be preventing that. And so education's a big part of it. Awareness is a big part of it. Managing, of course, for this example, the diabetes is a big part, but really understanding wound physiology, pathophysiology, and the arsenal of tools and devices and tests and measures that we can do to manage that wound, we really can save a limb and save lives. And I've seen it. I've been part of that. And there is nothing more rewarding when you are working with a patient who's been told by 4 or 5 providers, you need an amputation, and you see them, and miraculously sometimes in a short amount of time, when you consider how long they've been dealing with this, they walk out of the clinic on their own 2 limbs, ulcer free.
Yeah.
And it's just, I mean, how do you describe that? There's not words for that. So tremendously rewarding field. Frustrating at times, of course, but that's medicine.
Yeah.
But saving a life and saving a limb because you have the skills and know what to do, it's just, priceless.
Well, we heard a statistic that was a little scary as well, and it spoke to that the fact that only 50% of the wounds that should be treated with an advanced modality were still getting gauze and tape. That's a scary thought when you think of what could happen in terms of the morbidity rates when an amputation happens. These are real people and real situations that we're talking about. So, any thoughts on the educational side, on the knowledge side?
We've come a long way, but we still have a long way to go. And I think it really just speaks to awareness. I think there's a couple challenges. One thing where it can be a little frustrating is we have known since 1962, when Winter did his pivotal study using pigs and showed that moist wound healing is better on all accounts. And there was a lot of, information he shared in that article, but we've known since 1962 that a moist wound heals better, AKA using advanced dressings, providing a moist wound healing environment. Yet still, to your point, people are doing what technically is substandard care when you're just doing wet to dry gauze dressings and not really thinking about what that wound or that patient really needs or what they could benefit from. So the awareness component is huge. And I think we're challenged in wound care because we don't have a spokesperson that's really willing to stand up and say, I have a yucky, smelly, stinky wound, right? Nobody wants to be that person. Where we've got Michael J. Fox representing Parkinson's. We now have Kathy Bates representing lymphedema. We really don't have a face to wound care. And I think sometimes that's what it will take to kind of get that awareness and get people talking about it and understanding it a little bit more. Social media may help. I think that's a big part of leveraging that technology today. But I think people also have to be very good consumers and realize that not all wound centers are equal. They need to really tap into those professional organizations that are geared towards wound management, do some research and find out who are the trained specialists that are wound certified, advanced wound certified, that know what they're doing, that can demonstrate competency and that can provide the right care for that patient based off of their clinical presentation. So we have made tremendous gains, but we still have a long way to go. And I think part of it's just awareness and letting people know that there are options out there.
Mhm. Yeah, I heard another statistics. It was pretty scary. Out of the 500, out of every 500 clinicians that see or are exposed to a wound, only one is wound certified.
Whew.
Uh,
Yeah.
that's pretty scary. So if you have some advice, very few folks that get into wound care ever leave because they fall in love with it.
Absolutely.
Never. I mean, you just never see it. So for the caregiver that's considering wound care as a subspecialty or a specialty,
Yeah.
considering taking that first step into being certified, into being more of an advocate for the patient, more of that specialized care provider, what advice do you have to them? Looking back on your career 25 years ago, who would have known that
Right.
you'd be where you are now?
Right.
What advice do you have for someone that's considering getting into it?
I say if they have the interest, go for it. I mean, there is such a need for people to get certified and trained. And I mean, talk about job security. There's definite job security there, especially with the aging population and patients living so much longer with these advanced diseases. And the skin is oftentimes the visual biomarker that there is a systemic disease going on, but we can manage that. And it is such a rewarding field that I highly encourage anybody interested in it to get trained, get education, explore it a little bit, shadow somebody, just get a sense of what it's going to be like. It doesn't mean you have to do it full time. There's per diem, there's part-time, there's week. I mean, there's so many different avenues where somebody could dabble in it, let's say a little bit, just to get their feet wet to see if it's something that really speaks to them. But there's such a need. And to your point, I think once they get in it and they literally see with their own eyes what they're doing is making a transformative difference for a person in their life and saving a limb and saving a life and the impact it has on their families, they won't go back. I mean, it's just, it's yeah. Go for it.
If you're going to look over the bow over the next decade or two, and as you think about what it's going to take for us truly to drive change. If you look at the last few decades, there's been very little improvement in the healing rates, the diabetic foot ulcer rates. As you look at product innovation, advanced education, more and empowered clinicians, what combination of things is it going to take for the whole industry to see real, tangible, significant change?
Well, I think that's a very good question, multifactorial type of question. I think, reimbursement definitely is something that needs to be addressed. People need to recognize that this is a significant problem and a significant drain on the healthcare resources in this country. I mean, Dr. Ennis back several years ago said it best that more people suffer from chronic wounds than Alzheimer's, Parkinson's, and most forms of cancer combined.
Yeah.
I mean, we're talking millions upon millions of people, and yet it's kind of a hidden disease, for lack of a better way to describe it. So, it's still going to, down at the root of it, it's going to be awareness and education. But I think we have to drive endpoints of care, not just being full wound closure, but having different endpoints to look at. We've got to bring down costs of doing research so we can continue to see product innovation and development. We are at an exciting time with stem cells. I think we're going to see 3D printed skin and tissues very soon. A lot of point of care, individualized care, just based off of literally like litmus tests, at the bedside. Regenerative medicine is going to be one of the big things I think going forward too. So we kind of have to be prepared for all of that, but we need people that are committed to staying within this field and ready to heed that charge, because it is going to continue to grow and evolve, and we just need to be ready for that.
Yeah, excellent.
Yeah.
So when you're not speaking and teaching and on interview panels and that what do you like to do for fun?
Well, I have twin boys that keep me very busy, and I enjoy them immensely. They're wonderful. So spending time with them, I love reading when I get a chance, traveling, cooking, just some downtime. And I sometimes struggle with that because I don't know what to do with myself when there's downtime. Being with friends.
I can identify with that.
It's hard. I have to be mindful of that. But friends and family, like I said, I really do enjoy traveling, and just just trying to be mindful and being in the moment. So that's some of my favorite things to do. But my boys keep me busy for sure.
Well, Heather, it has been an absolute treasure to spend this time with you. I've been inspired. I think that others will as well. And it's so cool to see the other side of a person that's in front of a panel or in front of a podium or in front of a classroom, even to get to know their story a little bit, because there's hundreds or thousands of stories like yours. Yeah. And we're going to try to uncover that a little bit to have some fun with it. So,
well, I think it's great you're doing this, because I think everybody does have a story, and I think people can relate to that. It's like, oh, I never thought about that, or, but again, follow your passion. If you're interested, go for it. It's such a rewarding profession, and there's wonderful people out there doing great things. So I want to thank all the other people out there doing wound care and everything that you're doing as well. So thank you very much for your time too.
Awesome. Thank you, Dr. Hetrick. Have a great evening.
You too. Thanks so much.
All right, bye-bye.
Bye.